Talk's very own.
So as we wrap up Breast Cancer Awareness Month today, we are shining a spotlight on breast cancer in men, in fact, because according to the CDC, about 1 out of every 100 breast cancer diagnosed in the U.S. is found in men.
So joining us now to raise awareness and really help shed the stigma of breast cancer in men is breast cancer survivor Marc Futterweit and leading radiologist Dr. Robert Bard. So good morning to both of you. Thank you for joining us this morning.
Good morning.
And Marc,
Marc,
thank you for joining us as well. Share with everybody how you actually discovered that you as a man had breast cancer.
Well, I'm actually a 2-time survivor.
Wow.
Once wasn't enough. But the first time I had a discharge from one of my nipples, and it turned out to be a clogged mammary duct, but it was something that just came out of nowhere. The second time, a pimple showed up where my nipple used to be. So you just have to be aware of different changes and so forth in your body, and don't wait.
Yeah, Marc, you know, perhaps one of the biggest misconceptions is that men cannot be diagnosed with breast cancer because they don't have breasts, but that's not the case, right? You've been so vocal about how you, in fact, in the beginning were ignorant to it, but then now, like you say, you've been through 2 rounds of this.
Exactly. When I was first diagnosed, my doctor told me, "Oh, I want you to have a mammogram." I said, "What are you talking about? I don't have breasts." And he looked at me and said, "What do you think you have?" Yes, men do have breasts. We don't have breasts, but we have breast material. And
Right.
basically, it's a little more difficult to diagnose, to find than just somebody or a woman who would go for a normal mammogram. But Dr. Bard can explain that a little better than I can.
Yeah, because it's so difficult to diagnose, Dr. Bard, what are some of the symptoms then that men should be aware of when they're kind of thinking about this?
Like Marc said, men usually feel a lump. However, any painful area, any red spot, anything new in the breast needs to be checked.
And also tell me about this, which kind of men are most at risk? Is there a specific age that maybe men should start to kind of think about this or kind of look for signs?
Like all cancers, it can strike men younger or older, so it's not age restrictive. However, people who are at risk, like people who are exposed to toxins, radiations, for example, the firefighters, the guys from 9/11 that we've been following since 9/11 because of the toxic exposure, they're at risk.
Marc, you say you now probably walk around the beach showing off your scar, sharing your story, but was it hard to shed that stigma? Because I think some men do feel like that is attached to having breast cancer as a man.
Well, luckily for me, I think the way speaking about it is therapy for me. My wife and I both decided right in the beginning that because, I don't want to say I got off easy, but we've lost a lot of friends that we have made through the years. And it's very, very difficult. And because I'm still here, I think that my mission or our mission is to get the word out, because awareness is the first step in finding a cure to this. And like I said, therapy for me is still talking about it to everybody and anybody who wants to listen.
Dr. Bard, can you do me a favor? I don't know a lot about this. Can you explain the process for a male mammogram, what that looks like?
Actually, the male breast is obviously different from the female breast. It's closer to the chest wall, so we don't do a mammogram, which is, first of all, painful on very small breast tissue.
Yeah.
What we do is we do the sonogram first. The sonogram can make sure if it's a cyst, a benign fatty tumor, or something that looks serious like a breast cancer or something really suspicious. So mammogram is the last thing we do. However, if we do see something on the sonogram that looks suspicious, we turn on the blood flow. And basically, if anything has this many blood flow cancer vessels in it, it's bad. If it has this many, it's not bad. Of course, we have technology that shows how aggressive it is quantitatively. We have 3D imaging with Doppler blood flow and their new non-invasive contrast agents. In other words, like the MRI and the CT scan have dyes. The dye we have is non-toxic, non-invasive.
Doctor, is there a percentage of men who do get breast cancer?
Yes, it's 1%. As a matter of fact, the first time I saw breast cancer was in San Francisco about 30 years ago during my internship. It was unheard of then, but now the percentage is going up to 2% because everybody now is exposed to plastic toxins and the environment, and now this viral epidemic is certainly increasing the cancer rate and decreasing the screening men are getting. So, get checked now if there's a problem, a discharge, a lump, a red spot, painful.
Yeah.
Get
Yeah,
checked
I want to
because
put the
the sonogram
graphic
takes
back up,
5 minutes.
doctor, because I think it's really important. We had the self-exam graphic that shows you how to do a self-exam on yourself. It's very similar to a female breast self-exam. For men and women, this is something we all should be doing, and I think it's a very good reminder, as you say, that early detection is key for survival. So both of you, we thank you so much for your time today, and not only sharing your story, Marc, but informing us that, there shouldn't be a stigma to this, because it's all about saving your own life.
Let's remember that breast cancer does not discriminate. It's not female breast cancer. It's not male breast cancer. It's breast cancer.
Right.
There
And
you go.
we can all be saved by that.
Marc,
Please.
thank you both for your time this morning. And for more information on this type of breast cancer, you can go to malebreastcancercoalition.org. Appreciate you both being here. Stay safe.
Yep. All got to do
thank
is
you.
self-exams.
Yeah,
Thank you.
absolutely. And men, you are not excused. You got to do them. 10:26. Okay, coming up, the latest on your holiday.